So yes, I'm Lisa Story, and as April said, I'm the founder of Hope Grows. I'm also the executive director of Hope Grows as well. So what is Hope Grows? We are a nonprofit organization that actually looks after the emotional and mental well-being of that family caregiver. So all of our services, which by the way, our core areas of service are counseling and support, therapeutic respite, and also education and training. So our core beliefs are that caregivers not only need a break, they deserve a break. And we also believe that connecting to nature and the natural world is therapeutic. So we are positioned in Moon Township in a home, a residential home that is turning into an overnight bed and breakfast for caregivers to take a break away overnight. So I always, when I think of this, I'm also a licensed professional counselor, and all of my work has been in grief and bereavement, and I've worked in hospice for quite some time. And as I was, thinking of starting Hope Grows, and I was working in hospice, I would ask family caregivers when their loved ones were in respite for 5 days, sitting at the facility side by their side, what is the reason you're not taking a break? This is for you to take a break. And they said, we have really nowhere to go. If I go home, I will just probably clean and work myself to the point of exhaustion. I don't want to go far away because I don't want to be somewhere that I can't get to my loved one at the facility. And, and then there was, it's hard to trust that they're taking care of my loved one properly. So I would always start off by saying, you're right, nobody can take care of your loved one any better than you can. You are the best caregiver for that person, but you have to realize that you need to take moments to breathe. You need to take that opportunity to take care of yourself during this time. And so I would ask if there was an overnight facility nearby for you to go take a break away overnight, would you go? And 100% of the caregivers that I worked with through hospice said, yes, where is this place? I said, well, it doesn't exist yet. I said, but hopefully someday soon it will. And we are on that, we are on the possibility that this summer the facility will open for that. We had a couple setbacks this year because of COVID, but we're on a good track right now to get the place open. But so basically what we do is we cultivate caregiver wellness. We look after their well-being to make sure that they are taking care of themselves the best that they can. And we do that through quite a bit of services. So one of the main services that we provide is a program called Think Caregiver, and it is a phone check-in program. So caregivers can opt in to receive monthly check-in phone calls. Sometimes we're just leaving a message. Sometimes we get somebody on the phone and we talk for maybe 5 minutes, sometimes 20 or 30 minutes. But those making those phone calls, they're listening for a further need for a support group or a resource or a referral for their loved one. We're also listening for, I hate to even say it, the suicide risk, because caregivers get to that point of feeling like they need to just jump the bridge. And that's what we're there for. We do mental health counseling. So, we have a lot of in-person services for our caregivers. We're not just having to refer out. We can always refer within our own organization. So Think Caregiver, I always say it's a gateway into the support that a caregiver might need emotionally or mentally. So that's pretty much who we are. But today I want to talk a little bit about stress. And, that's probably our #1 topic here at Hope Grows, and what we do for caregivers is evaluate stress. And we like to use a balloon. So think about a balloon and you're blowing that air into it, and think about that stress. That balloon, if you have so much stress and you keep blowing that balloon and blowing that hot air into that balloon, eventually that balloon's going to pop. But we usually we give caregivers balloons. So we always say, when you're feeling stressed, start to blow that, think about the stress, blow it into that balloon, blow it as little as you want or as much as you want. And then you really have 3 ways that you can release that stress. 1, you can pull the balloon apart and make a squeaking sound. If you really want to be heard, squeak it. Otherwise, you can, let it go, let the balloon float into the air, or you could really blow it up really full and pop it. I had a caregiver at a presentation that I did say to me, can I blow it up and then take a pin and pop it? And I said, if that's what you want to do with your stress. And she goes, yes, because I'm just so angry right now. I can't stop this anger that I have. And I said, absolutely, pop the balloon. So, so that's one of our tools that we provide our caregivers. But one of the biggest things though with stress, and everybody has stress, right? I do, we all do, but is it manageable? So we try to get caregivers to acknowledge the effects that stress is having on not just their mind, but their body and their spirit. I think we need to be aware, because if you're not aware of the stress within you, you're not going to know that you need a break. So I always stress too that when we feel off in one area, like physically, or we're hurting physically, it could really affect our emotions, our mind, and our spirit. Just like if we are, if we're mentally stressed, it can really affect our physical and our spiritual. So it can affect all areas of who we are. And it's also important that we also share the information to caregivers that it's important to recognize the signs of stress earlier in order to implement self-care, and then also to get the help and support that we might need. Just like I said, our lives are busy, but if you think about stacking rocks, those flat river rocks, and you add the rocks on top of each other, as far as naming each rock to an area of our life that we're responsible for. And typically, you start out with what? Work, and then you go to family, then you go to social, all the way up. And then you add that top rock that's caregiving, and all of a sudden it starts to tumble because you can only stack so many rocks. So we try to get caregivers to name all the areas and where can you remove one of those rocks in your life. Or I had one caregiver said, well, why can't I get more support around the bottom to keep those stacks, straight so it doesn't fall. So there's different ways that caregivers can visualize the balancing that has to occur with providing care. But all in all, I think not just for ourselves, but caregivers too, we forget our most basic needs. And that's another thing we point out to caregivers is, are your basic needs being met? So have you eaten today? And what have you eaten? Is it nutritional? Have you slept? Are you sleeping? How do you feel in your environment? Do you feel safe? Do you feel secure? How much water did I drink today? We seem to forget that, to drink water. And is there something that you need? Checking in with yourself. Is there something I need that I'm not getting? And am I breathing properly? I don't know if people are aware, but sometimes when we're under stress, we hold our breath or we begin to shallow breathe. So you have to stop yourself and think, oh my gosh, when's the last time I took a breath or a deep breath? Because they can be extremely cleansing and extremely therapeutic. So that's the first thing, is asking yourself, are my basic needs being met? Well, one, acknowledge stress, then are my basic needs being met? And then putting into your day to think about these for many times, many times throughout the day, to stop and take a minute. How many minutes do we have in a day? I don't even know, right? Quite a few. But if you take a minute, morning, noon, and evening, that's 3 minutes out of a day to acknowledge stress, to ask yourself your basic needs. I struggle doing that. It's not easy. None of this is easy to do. But it's things that we need to put in our incorporate into our day. And then also, then you go on to, stress can manifest in a variety of ways. The stress that our mind can have shows up in anxiety. It can show up in lack of motivation, irritability or being angry, restlessness, sadness, or depression. So then we have our body, there's recognizing the signs in our body: fatigue, chest pain, headache, sleep problems, an upset stomach. And then the spiritual side of stress: no sense of purpose, struggling with the meaning of life, loss of faith, anger towards a religious system or belief, So these are examples of stress in our mind, our body, and our spirit. And then, try to recognize those. And then you want to maybe identify your personal warning signs and your signs of stress, or sources of stress. I'm sorry. My personal warning signs, I like to put it out there, is that I get really crabby if I'm really stressed. So that's my first indication. That's my warning sign to say, oh, wow, you need to check in with yourself. You're being really crabby to being crabby to my spouse, or snapped at, my sister or something. So, and then I evaluate, what are my sources of stress? My source of stress is just balancing too many things. It's just overdoing it. And everybody has different warning signs and different sources of stress. And those are some things we need to consider. So once we do all of that, the goal here is to put these things into practice. And then we also want to implement a self-care plan. Just like when you're baking a cake, you've got ingredients to follow. And you pretty much, when you bake a cake or cookies, you really have to measure those ingredients almost exact, right? To get it to come out tasting the way you want it to. So think about that when you are putting together a recipe for self-care. You want to make that list and have that list so that when you are recognizing and acknowledging your stress, you can fall back on that self-care plan. So yeah, so that's just sort of a quick acknowledging the effects of stress 101. Some of the things that we do, for our caregivers as far as education and training, we do quite a bit of different programming throughout the year to help caregivers, recognize the things that they need to put in place for their emotional and mental well-being. But yeah, I don't know what else I can share today. I think I'm probably at my time. I wasn't timing myself, April. I don't know, am I over or under?
You know what? I don't even know, because I wasn't even timing myself, but it looks like we're on target. 2 o'clock, so we're good. For some reason, I trusted everybody today.
So when I just want to put one last thing out there, when you hear the words hope grows, know that hope does grow as a caregiver, and that we are a resource to, help you through your emotional and mental journey in providing care for your loved one. The best thing I can tell you to do is get signed up on our website for all of our programs and services, emails that we send out. And we do offer quite a bit through the year for caregivers to engage and support. So thanks for the time, April. I appreciate it.
Awesome. Thank you, Lisa. We did have a question that came across the chat. They were asking if you offer massage for the caregivers.
We do not, but once the Iris Respite House is open, we are planning on having spa and salon amenities here. I'm not sure if that's going to happen at the time we open the property, but yes, we do plan on incorporating that here. Okay. Not right now, but hopefully soon.
Anybody else have any questions for Lisa? I guess not. Okay, thank you, Lisa. Next up, we have Maureen Siriani.
Awesome. Hi, everybody. Thanks so much for having me. It's honestly like icing on top of the cake to go after Lisa, because she embodies everything that I believe in. I've worked for Country Meadows now for over 25 years, and all I've ever done is work in memory support and supporting families as they are caring for loved ones. And I have to tell you, it's not easy right now, especially during COVID. And so I really wanted to kind of speak to that message today. As you can tell, I mean, we're all under a lot of stress. Things are a little bit crazy. I kept myself on mute the whole time because I'm in a senior living community and they were just singing Christmas carols, and I'm near the elevator, so it's kind of loud where I am. But I just wanted to go ahead and kind of share a little bit about me and what I do. I'm kind of like a professional handholder and cheerleader for family support and for those living with Alzheimer's disease and related dementia. And I was kind of taking notes as you were all talking. And Roxanne spoke to something that I see every day. And that's a lot of families that just haven't pre-planned and didn't want to see the writing on the wall and didn't want to kind of acknowledge that their loved ones were getting older or becoming more fragile, and didn't want to step into that role of caregiver or caretaker until they were kind of forced to do so. And so I first wanted just to address a couple things. Like I said, I directed my 10 minutes towards really talking to the individual that's caring for their loved one with dementia, or even if they don't have dementia, they're caring for a loved one who is quite fragile in whatever their disease process is. And so the head and the heart disconnect definitely takes its toll on the caregiver or the care partner, because a lot of times families, especially right now during COVID, the phone calls that I'm receiving about people who are taking care of their loved ones at home now because of their jobs changing and situations changing because of COVID. And a lot of them have said to me, like, I had no idea that this kind of stuff was going on with my loved one. I had no idea that my loved one needed so much care or attention or assistance. And so sometimes they'll say things like, well, let's just wait and see, like maybe that was a fluke, or, you know, the comparing notes of adult siblings saying, did you see what I saw? I didn't see that. You know, no, you don't know what you're talking about. Let's just keep an eye on it. Then I have families that will call and say, we're just not equipped to handle this. Like, we had no idea how hard it was going to be to take care of my loved one at home. And then the guilt kind of kicks in, where they say, well, we always promised that we would never place our loved one. And maybe if we all pitch in, you know, we can make it work. I hear that a lot. And then I start to notice some of that family stress and some of that stress that Lisa was talking about. Because usually if it's multiple siblings, they'll be saying, well, I do more and some don't do any. And so again, that causes a lot of stress and a lot of pressure because the head is so factual in its thinking. And then the disconnect from your heart just comes from the fact that, you know, we know that our loved ones are slowing down as the aging process continues. And, you know, you kind of get this push and pull of your own heart saying, well, maybe if I do more, or maybe if I spend more time, my loved one will perk back up. And sometimes that is the case, but in the disease process, specifically with Alzheimer's disease and related dementia, you know, we know that it is a slope and it is downward as it's a progressive disease. Then a lot of times, you know, there's that fear of the unknown. Family members feel that if I do need to have extra care, I'm viewed as a failure because I wasn't able to do it myself. If I do have to, you know, place my loved one in a long-term care facility like a nursing home, or a personal care facility like Country Meadows, or an assisted living facility, or an adult daycare, they don't want to lose their relationship. They don't want to lose their identity, and they don't want to lose their control over their situation with their loved one. So I always encourage family members, especially if you're taking care of a loved one at home, you want to do some journaling and some logging. And you really want to observe and investigate so that you're able to really understand what your loved one is experiencing, and it helps you to stay connected to them. So a lot of times we look at just some common factors. We look at the daily physical challenges. And I believe it was Jeff who spoke to some of these points that I'm going to talk about. You know, the physical challenges with bathing or dressing or grooming. And I want you to connect the dots with that, especially if your loved one has some form of dementia, because a lot of the cognitive challenges that we see are the fact that people with dementia have a really hard time with follow through and with thought process. So they might not be able to shower or bathe because they don't know how to initiate that activity, and they're not successful once they have gotten it started. And so these are things that you want to track and you want to, you know, keep an eye on, and it helps you adapt the way you react and respond to your loved one when you're really tracking and really observing and really looking at the signs that they're giving you. Even if they are verbal or nonverbal, they're still speaking to you with their body language. So you really want to observe your loved one, and you'll be able to meet their needs once you understand what their challenges are. I also tell families you really want to look at their sleep patterns. That includes napping. If someone is sitting in front of the television, relaxed and resting all day long, odds are the body's going to get restless and they might be up all night. And so you want to make sure that there's enough physical stimulation, exercise, dance, movement, chores, even asking your loved one to push a broom or unload the dishwasher or wash some dishes. It's still physical activity that helps them burn off energy so that they're able to sleep better in the evening. You want to look at cognitive stimulation as well. For someone that might be in the early stages of the disease process, you know, they're still able to read, but encourage them to read out loud to you. That's multifaceted when you think about the fact that they're reading out loud, they're hearing themselves read, and they're engaging with you. Writing, puzzles, drawing. If someone is not able to maybe read or write as anymore or as well as they had in the past, using manipulatives, sorting, searching, matching. These are all cognitive stimulants that can take some of the pressure off of the family caregivers throughout the day. Again, these are just some short specifics. I love this topic so much. I could talk for 6 hours, and Janet Dennison knows that. And I only have 10 minutes, so I'm just hitting some quick bullet points for everybody. But this was important to me, and I wanted to share this with you if you're caring for a loved one at home, whether it's a new diagnosis or you've been in the battlefield for quite some time now. It's never too late to build your team of support. Okay, so I want you to think about it this way. And this is where you want to kind of remove the emotion for a little bit, because it's such an emotional time. When you begin with your family, you really want to break down what each person is able to handle, what each person is capable of. You know, some might be emotionally hands-off and they might say, you know, I'll take care of the finances, or some might not be working and have, you know, a lot of time, and that person might be the one that's the physical hands-on caregiver. And another, you know, sibling or family member might be, you know, the pinch hitter, or the one that provides that respite, that opportunity for the more hands-on family member to take a break. So it's important that, you know, you really start to build that team. Now, sometimes I talk to families that are a team of two, and it is the person with dementia, and it is their spouse or their adult child, and there is no other family. That doesn't mean that that's not still a team, because then you look to the next level, and that is friends. And what I mean by looking to your friends is you want to connect with someone who's non-judgmental, somebody that can be a safe place for you to vent or to place your feelings, to just kind of get some of that frustration or some of that anxiety or stress that you're feeling out. You know, I think every person needs to have a capable, trusted, caring listener. And I'll speak to that point at the last slide. And then also too, just like many of you are doing today, you want to seek out the professionals. You want to find out what people can teach you. And I can tell, because I've been doing this so long, when family members first get this diagnosis, it's like they stop dead in their tracks and they can't even form a thought. They just feel like their body is just, you know, stuck in the mud, and they don't know what questions to ask first. They don't know what resources are out there or who to connect with. And again, I think it's extremely important that you seek as many professional networks as you can in order to know what is out there and what is able to really kind of help you fit the journey that you want for your loved one. And also too, and I always remind everybody, you know, asking for help is not a failure. I know, like I said, here at Country Meadows, I've run a support group through the Alzheimer's Association for over 20 years. And a support group isn't just learning facts and details about a disease process. It's about connecting other like-minded people that are in the exact same situation. And at this point, like I said, I've been doing it so long that I'm like the spider that weaves the web. The members of our support group really look to nurture each other as they're on this journey together. And like I said, I think that's something that I think can be very beneficial. Joining support groups right now are all via Zoom through the Alzheimer's Association. So if there's anybody out there that would like to join or would like to listen in on one, you can always reach out to me. My contact information is with April, and I can help get you started if you'd like that. And I also wanted to add this part because, like I said, I'm kind of like the cheerleader for the families and for the people living with Alzheimer's disease. I never want people to forget who they are in the relationship. And most importantly, I don't want you to forget who your loved one is in the relationship. So as you can see, you know, with this slide, you want to have permission to recall. You want to think about what that relationship looked like before dementia. You want to look at how your loved one navigated the space that they lived in, how they cared for their parents or maybe their spouse or a child, what was important to them in their earlier days before the disease process, because it can help you also navigate the way you care for your loved one now. And then you also want to have permission to recognize some of the challenges that you're facing in this current reality, and how to see those changes that need to take place. And I think oftentimes family members don't realize that they're the ones that need to constantly be changing, because the person that's living with dementia is constantly changing. So caregivers should move like water, in and out of all the challenges throughout the day, and being extremely flexible as possible. And again, you want to remember that stress can cause people to not be capable of making decisions. And I do believe that Roxanne had made a comment somewhat similar to that, because I had jotted something down. Like I said earlier, she had just made a point about getting things organized. And so it kind of lines up with what I say here. You don't want to wait for a crisis to force you to make a decision. You want to get to know what services are out there before you need them. I always tell people, get to know Country Meadows before you need us, in hopes that you never need us. Because I think that helps caregivers make confident choices and feel comfortable with the decisions that they have to make. Because then again, at the end of this little slide, you can see it's permission to ruminate. It's to allow yourself to look at what the future may look like. Do you need assistance for the family? Is it in-home? Can you rely on friends? Can you rely on professionals? It doesn't mean that you've failed if you've asked for help. Because again, you're building your team. And I think it was that last slide that I had on, pull it up, see if it's there. Yeah, you see that globe right there? I put that up there for a reason, because especially when I'm talking to family members, I help them to understand something. Say everybody on this Zoom call was actually sitting at a big boardroom table, and I had that globe in the middle of the table. Everyone there knows that it's a globe, right? We all see it, we know what it is. Except if you're sitting across the table from me and I'm looking at Africa, you might be looking at the Netherlands. Someone else might be looking at Australia. Someone else might be looking at Hawaii. Fact is this, everybody loves the person that they're related to that has dementia, but they all see that person in a different way, in a different angle, because they have a different relationship with them. And so I think it's important to recognize that when you're building your team. You don't want to judge or misjudge another care partner or caregiver, because they might have a different relationship than you do with your loved one. And I think when people recognize that and appreciate that, it helps them to find some more compassion in how they care. And then I wanted to add this from the professional side of things, because help does come in many shapes and forms. And Jeff had spoken to it, and so did Kathy, and so did Roxanne. And so I just wanted to add, again, a little bit more to what they had said and piggyback on that a bit. So you know what, if you're caring for a loved one at home, it's baby steps sometimes. Sometimes you might start off with a home health visit. That might be a visiting nurse, PT, OT, speech that comes into your home. A physical safety assessment can be provided free of cost. That's something that I do. I want to keep my loved one at home as long as possible, and I want to make sure that the physical home is safe. Can someone come and take a look and make sure that I can keep my loved one safe here? Cognitive awareness assessments provided free of cost. Again, that's something else that I do, just to help family members understand what level of cognition their loved one is at. It's extremely important for them. I do believe that knowledge is power, and the more you know, the better you do. Again, we heard earlier about adult day programs. You want to investigate them in your community if that need arises for you. Again, having somebody come into the home as a personal assistant, or maybe just somebody to help with some cognitive stimulation is something that's really powerful. I always encourage families to also look at your churches or even student nursing programs. There's a lot of student nurses out there that would love to make a couple of dollars under the table, and they also can get some good time built in with bedside manner if you bring somebody into the home that that has a little bit more of a background and understanding. And these are just, like I said, just some tips and ideas that I thought maybe those of you that are on the webinar today could just appreciate to take care of yourselves and your loved ones. We talk here about personal care, respite opportunities. If you just need some time for yourself. I know when I speak to that, I think about Country Meadows and how we offer independent living. We also offer personal care, but we also offer a progressions restorative program. And so oftentimes I've heard family members, they'll call me and they'll say, oh my gosh, I don't know what to do. I just talked to the social worker. My dad had a fall a month ago, and you know, he's getting out of the hospital. They said he's going to be released in 3 days, and you know, he's done with PT. There's no more PT order. And they don't know what to do because they don't think that he can be successful at home by himself. And, you know, if that person lives alone, and they're, you know, that's a really challenging and scary place to find yourself in. So this progressions program that we provide is 30 to 60 additional days of PT-styled programming. And then after that, a lot of times people will go back home and be stronger and be more confident to live on their own longer. A Pathways program is a permanent program that we have for people that aren't successful living at home and do have physical challenges, which I think is, you know, can be very scary for family members, especially if they don't live with that person. And then a memory support program as well. And also too, like many of my colleagues have said, a respite program. I just talked to a family member the other day, and she was reminiscing about not this past summer, but the one before, when she brought her husband here for 2 weeks so that she could go to California and be the mother and the grandmother, you know, to her family. And I think that little things like that, to be able to provide those opportunities to the community are so important. And what Hope Grows is doing with even just an overnight stay, that's so valuable. And there's so many people out there that need it and want it, and I think are afraid to admit that they could really use it. But again, I think it's important to investigate as much as possible. And then lastly, I always remind family members, you know, you're coming out of a place of love. Everything that you do and everything that you need help doing shows how much you really and truly love and care for your person, you know, that's living with dementia. And again, I just wanted to remind everybody, I'm a certified validation method teacher. I studied under Naomi Feil, and I have to say, you know, validation method is a form of communication. It's non-pharmacological, and it's based on empathy and non-judgment. And it just really helps people with Alzheimer's disease and related dementia be able to communicate to you, a capable, trusted, caring listener. And I do presentations that are free to the community, free to caregivers. And I just want to make sure that, you know, everybody on this webinar today knows that I offer, you know, my resources as community outreach and support. And just really wanted to thank you all for listening today. Thanks, April.
You're welcome. Thank you. Does anyone have any questions for Maureen? What a great presentation.
Thanks.
I learned a lot from that. That's awesome. All right, next up, we have Richard Greer, who's with Saliba Wellness. And I believe you had a presentation that you could share with us too. Share your screen. Let me make sure I'm not sharing mine. Okay.
Okay, can everyone hear me okay and see my slide?
Yep.
Awesome, thank you so much. First of all, good afternoon, everyone. This has been awesome so far. Just really honored to be here, presenting with everyone else as well. So a little bit about myself. My name is Richard Greer. I'm the pharmacy director at Saliba Wellness. I started my journey into pharmacy back in 2011. And actually my first pharmacy job was with Omnicare Long-Term Care Pharmacy. If I'm being completely transparent, I actually got that job not necessarily with a dedication or any sort of commitment to elder care, but I have loved everything I've done from a long-term care standpoint in the world of pharmacy. Just really getting to understand the geriatric population, understanding their needs, understanding their vulnerabilities, and really, just providing the best level of care to ultimately what is a vulnerable population. From Omnicare, I've had several jobs in the past 10 years in the pharmacy world. Prior to starting with Saliva Wellness, I was actually with Leechburg Long-Term Care. So again, a lot of that geriatric, more residential type care overall. Closed door pharmacy, very high on medication reconciliation, consultation, those kind of things as well. I was fortunate. Saliva Wellness we opened our doors in February of 2018, which was the first time any medical marijuana dispensaries were allowed to open in the state of Pennsylvania. I was very fortunate. Saliva hired me at the tail end of 2017, brought me on to help get things ready, set up, have a smooth opening, smooth transition, everything. And it's been an absolutely wonderful 3 years. Very rewarding. I never really anticipated or expected I would end up in the world of medical marijuana. But like I said, it has certainly been very rewarding to see a lot of the patient success stories we have seen along the way. Let's see. There we go. So, as most people on this presentation would probably agree, we're given 10 minutes. I could probably speak for about 10 hours, to be totally honest, on my topic. So, if things seemed a little scattered, I do apologize. I'm trying to get through this as quickly as I possibly can. More than anything, what I want to leave everyone with is some resources, not only to follow up with myself, but just general resources for the Pennsylvania program overall. Not only how to sign up as a patient or caregiver, but also how to obtain just more general information, more education, just really anything else I wouldn't be able to cover today. Let me start really with just what is medical marijuana, because there is really still a lot of, I guess I would say, misunderstandings and miseducations out there as to what medical marijuana actually entails. Most people, well, I guess I shouldn't say most people, but a lot of people, they just associate medical marijuana, with something they did in college, something they did more on a recreational level. They're used to smoking it, actually lighting the plant itself on fire and inhaling the exhaust or the smoke of that fire in and of itself. As a pharmacist, one thing that really fascinates me about medical marijuana as a medication is how versatile it is in terms of different ways it can be administered. It absolutely can and is inhaled as a medication. But at this point in Pennsylvania, we pretty much have everything available in terms of options for to give people relief as a medication. Like I said, you can inhale medical marijuana. You can dose it under your tongue sublingually, typically in the form of a tincture. And when I say tincture, I'm just saying a liquid form of medical marijuana. But there's a couple other forms that potentially could be dosed under the tongue as well. We have capsules, very easy, very precisely dosed. Fortunately for me, most people are familiar with taking pills or taking some kind of tablet or capsule. So oftentimes that is an easy and familiar way to give medical marijuana to patients. We have other things, other type of inhaled forms. We have things called loose concentrates. We have different types of oils that can either be swallowed and or potentially inhaled as well. The other thing I would really like to point out, especially to a senior population, is the use of topicals. Now, topicals in and of themselves, they are definitely designed more for a localized pain relief, which is wonderful. If, it is a patient suffering from pain, they do tend to be very effective, and they also tend to have little to no side effects. I would say topicals are one of the forms of the medication people are most hesitant or maybe a little bit skeptical of and think it may not be as effective as they would like it to be. But it's also one of the products, believe it or not, we have a lot of difficulty keeping in stock, because typically once people try the topicals, they see how effective it can be. And, it really gives patients a lot of relief most of the time. What we do with our patients at the dispensary level is we really try to do a very comprehensive intake process and really intake screening by a group of pharmacists when people first come to visit us. We are not physicians, nor do we necessarily pretend to be physicians in any way, But really, when you come to see us, it does have that feel, and definitely should have that feel for people that are visiting us. Our paperwork feels very much like you're going to a doctor's office. Very heavy on demographics, very heavy on health history, getting into social history. Have you ever used medical marijuana in any way, shape, or form? Do you drink alcohol, smoke tobacco, those different kinds of things? With the health history specifically, really what we try to focus on, we definitely want to obtain a medication list to see if there's any sort of any medication interactions we potentially want to be aware of, or counsel and screen for to help prevent. We need to see and know about any kind of surgical history to see if there's any kind of conditions or anything withstanding that may affect our recommendation. We want to get into really any other disease states. Now, and I'll talk about this in a second, but in Pennsylvania, under a medical program, you do have to qualify as a medical marijuana patient. And the qualifying conditions, there's 23 right now. By far, our most common condition is pain, but we also have anxiety that was added to the list. It's actually general anxiety disorder, which that was added to the list approximately 1 year ago. We are seeing, especially in the calendar year 2020, a lot of new patients coming in with a qualifying disease of anxiety. I'm not going to go through the whole list, but cancer is on the list, HIV is on the list, terminal illness in and of itself. There is multiple sclerosis, there's ALS. But like I said, generally, it is pain and anxiety that we are seeing most frequently by most patients. I always say, though, really a qualifying condition or really any sort of diagnosis, to me, that tells me something. If someone comes in and they've qualified under chronic pain, yes, I can kind of make some assumptions. I can kind of potentially start to think about where therapy may be directed, but I really do need to sit down and talk to the patient and start to unpack truly what their symptoms are. What has their pain caused them? Has it affected their interpersonal relationships? Has it affected their appetite? Are they not able to sleep due to their pain? Has it left them incredibly depressed? These are the screening type of questions that we need to go through at a dispensary to see how we can really offer an overall benefit to the patient. I like to tell people most of the time, I can offer some level of pain relief, but if your pain level is a 10 out of 10, and let's say I even get that down to a 5 or 6 out of 10, that is a win. But I also don't want you sleeping 18, 20 hours a day, those kind of things. I need to be able to provide a relief that is not going to offer any sort of negative in any other aspect of their life. Or even better, hopefully I can help with some other things. If you have pain that is comorbid with depression, maybe I can start to work on the depression a little bit depending on my recommendation. Or if it is sleep, or if it is anxiety, or whatever is coexisting with the qualifying condition, more often than not, we can help. We don't always get the recommendation correct on a first visit, although obviously we definitely try our best to do so. But after speaking with the patient, we can make a recommendation. We expect to not only be beneficial, but what we do on our follow-ups is really start to assess any sort of relief we are potentially providing, what improvements we can make, what is working, what is not working. I still have my list up of available options in the state of Pennsylvania. It's probably on a first visit, one of the most important things that I can really assess is what is the patient even comfortable doing? Again, so much of medical marijuana is tied to inhaling. A lot of people, a lot of times they don't even understand what other options there may be out there for them. That is, again, one of the biggest things I can assess the first time I meet someone. If a patient is very dead set and very hesitant to inhale, try an inhaled form of medical marijuana. That is absolutely fine. And my job is to reassure them, not only do we have other options, but honestly, they're not missing out on much. I have plenty of other options that I can provide and recommend that we would hope to be equally as effective, if not potentially more effective than inhaling the medicine, that the patient will obviously be more comfortable with and a lot more likely to use and get benefit from. Surprisingly, or maybe not surprisingly, actually more often what I hear from patients is they are sick of pills. You know, especially as a pharmacist, I've seen the medication loads. You know, I've seen patients with 12, 15, 18 pills a day, if not more. I totally understand it. And not only can it be overwhelming, you know, it starts to speak to lower compliance. Medication regimens alone can be a source of anxiety for a lot of people. So again, I'm actually very fortunate in my role. If someone is just sick of pills, you know, they'll do anything but another pill. Again, I have those options to provide and to give to people. But again, one thing we pride ourselves on really is that initial intake and initial assessment, and seeing if and how we can get the journey to relief started. So I have some resources on my screen here, but I'm going to kind of talk through how each or all of these could potentially be used. If you jump down to resource number 2, I have on here medicalmarijuana.pa.gov. That is the website that is completely comprehensive with everything to do with medical marijuana in the state of Pennsylvania. That is where I had to go to take my training to be a pharmacist, to be credentialed to work in a dispensary. That is where a patient goes to actually register with the patient database, as well as find a certifying physician to go to and actually get their recommendation or certification for medical marijuana. That is where the patient pays for their card. And this is where things are going to get a little bit confusing. So in the state, again, every individual patient has to qualify as, you know, as being, again, as qualifying for medical marijuana. So what that process looks like, and again, the list of 23 conditions is on that website. If someone has one of those 23 conditions, they go and see their certifying physician. One thing I would like to point out, the certifying physician does not need to be it does not need to be the person's primary care physician, nor does it need to be their specialist. It does not need to be a doctor that someone is already established with. The list of certifying physicians is on that website. What the patient does, they schedule an appointment with the physician. They provide documentation that they do have the condition that they claim to have. And ultimately, the physician uses their professional judgment to either give the patient a medical marijuana card or deny them the card. I will say our physicians in the industry, they tend not to be a barrier or any sort of hurdle to patients getting medical marijuana. They are not recklessly issuing cards to patients. However, I tend to say if a physician thinks that someone will benefit from a medical marijuana card, there is a way to get a card in their hand. Every patient does have to qualify by a certifying physician. There's no age limit. There's no minimum or maximum age to being a medical marijuana patient in the state. I personally have consulted with patients as young as 14 months, and my oldest patient was actually 97. I haven't seen anyone in triple digits yet, but I've gotten pretty close. Once the patient qualifies, one thing I would like to add, at this point with COVID, as you know, most people are familiar with, there's not many in-person visits going on, especially in the medical marijuana world. To see a physician and to get certified for a patient card, I really want to say all of the visits at this time are done virtually, either through Zoom, Teams, or Google Meet, or some kind of virtual means. Once a patient qualifies, you actually have to pay the state $50 for the state to actually mail you the card, your patient card. Once the patient has the card in their hand, they can go to any dispensary. They'll get scanned into the dispensary system, go through a consultation, and ultimately purchase medicine on the spot. Now, where things do start to get a little bit confusing is the caregiver end of things. Caregivers themselves in the medical marijuana program, they also have to register with the state. So really, when you register, all you're doing is giving the state your information, your demographics, name, birthday, social security, address, those kind of things. The state of Pennsylvania does make medical marijuana caregivers go through a federal background check. which does include getting your fingerprints taken. Ultimately, the background check ran, and a determination is made if you do or do not qualify to be a caregiver for the said patient you have. The caregiver process, well, actually, let me take one step back. The patient process, typically to see a physician, the physician is going to charge $200 for that initial certification. There is some variance there. I've actually seen certifications as inexpensive as free. You know, some physicians actually will do free certifications. I've also seen them as expensive as $700, although the free and the $700 are definitely the outliers. I typically say it's a $200 average fee to the physician to get certified. Again, it's a $50 fee to the state to actually issue the card itself. So right now, again, going on averages, to get certified and get a card in your hand, you're looking at $250. The caregiver, on the other hand, obviously a caregiver doesn't need to see a physician for an evaluation. They do need to register and they do need to do the background check. There's no fee to register as a caregiver. The background checks themselves are very inexpensive. They're less than $10. Usually around $7 to $8 is the fee to get your fingerprints taken and ran. Once those results come back, you do also have to pay $50 to the state to get your caregiver card. Now, a big distinction here. When a physician certifies a patient for their card, that happens instantly. That actually happens on the spot. And then once the patient pays their fee, typically the patient card is in their hand within a week. It's actually a very quick and efficient system the state has going. The caregiver process, on the other hand, that typically takes well over a month. You can register immediately and you can schedule an appointment to get your fingerprints taken, but typically the delay occurs waiting for those results to actually come back. And we've seen those result times range from about 4 to 6 weeks. So there can be definitely some disconnect there and kind of some disparity in terms of a patient having a card on their hand, but potentially not having a caregiver to come to the dispensary and, you know, purchase or go through the consultation on their behalf. This is a very important distinction to make because to enter any dispensary in the state of Pennsylvania, you do need to have a physical card in your possession. You either need to have a patient card in your hand or a caregiver card to gain access to the building and purchase on behalf of your patient. So if that all wasn't confusing enough, I'm actually going to skip back up to resource number 1. If you went to salivowellness.com, that is our main page of our website. If you scroll down just slightly, there is a link that says click on need a medical marijuana card. If someone is to click on that link, we have a little survey, a little interactive web page there where you give us some of your information. We reach out to you and essentially do our best to walk you through the process I just described. We like to consider it a concierge service, really just to kind of take the confusion out of this whole situation, because there's so many different facets to this. People, you know, they'll forget to pay their $50. They won't find the right physician. They'll get denied the first physician they see. So anyone that clicks on that link, need a medical marijuana card on our website, we are there to be as much of a resource as possible. And honestly, clicking on that link and going through those steps, there's really no obligation to follow through with the whole process. More than anything, what you're doing is giving us our information, really to give you some more information. It's obviously always on either the patient or caregiver's prerogative if they do want to proceed with, you know, the full process of getting their card itself. So really, it's just another level of service that we do try to provide. And the other thing I will say, there is no obligation, even if you use that service, to come and see us. Like I said, once you have a card in your hand, you can go to any dispensary in the state. I certainly would hope you would come and see us. But again, I'm not going to give a sales pitch. Really, that's at the discretion of the patient and or caregiver. The other resources I have listed here are leafly.com. Really, I list that just as more of a kind of comprehensive overall view of what is going on in the medical marijuana industry in general. There's more information about medical marijuana on that site. It's not always the most professional presentation, that particular website, but I do list it because their information is so comprehensive. They cover so many different topics. It is a very valuable resource to look into. And then number 4 on here, I have Cannabis Pharmacy by Michael Backus. That is a textbook. That's probably my favorite reference to go to as a very quick, almost like encyclopedia view of medical marijuana. I can very easily look up different conditions. I can very easily look up different strains. And I also like this particular book because he has so many resources listed that he cites in the book. That's one of the biggest things that I tend to come up against is, there's just not enough research. There's not enough data or information. It actually is out there. A lot of times it is international. It's not always US based. A lot of stuff from Canada as well as Israel. But at the same time, the information is out there. His book in and of itself is relatively inexpensive on Amazon. It's under $20 for a copy of it. But like I said, it's a very, very nice reference to have if, anyone is just interested in medical marijuana more in general. And that is it. I do have my name as well as my email there. I always encourage people to reach out to me with any questions. I get a lot of questions about CBD. CBD's everywhere now. It's at Sheetz, it's at Get-Go, it's at the pharmacies now. Any questions people may have, again, more than anything, I do try to be a resource of information for the, kind of medical marijuana or cannabis industry in general. No question is ever too difficult or too simple. I'll be glad to help out as much as I can. So I believe that is it. Thank you, guys.
Thanks, Richard. Does anybody have any questions? Anybody? Anybody have any questions in general or for any of the speakers? It's quiet. All right. Well, thank you guys so much for attending today. Again, I will shoot out everybody the revised version of the Meet the Speakers so that we have Hope Grows emails correct on there. And that way, if you have any questions, feel free to reach out to us at Seniors Blue Book or feel free to reach out to any of the speakers that attended today, and hope you can make future events with us. Thank you so much. Happy holidays, and everybody stay safe.
Thank you.
Thank you.